Welcome to today's program titled Return to Business, Getting America Back to Work Safely with Testing, Monitoring, and Safety Best Practices. At this time, all participants are in a listen-only mode. For those of you who are logged into the web presentation, you are encouraged to submit questions throughout the conference by typing them into the text box on the right side of your screen and pressing Enter. For those interested in obtaining CLE credit for this webinar, an attendance verification code will be read during the presentation that will be required on the CLE attendance affirmation form. Please write this code down. It will not be reread, and it is required for CLE credits. Copies of the webinar recording and materials will be distributed to attendees in the days following the webinar. At this time, I would like to turn it over to Jim, Carla, and Condon. Carla, you may begin.
Thank you. Good afternoon, everyone. I'm Carla Grossenbacher. I'm the Chair of the Labor and Employment Practice in the DC office of Seyfarth Shaw. And on behalf of the firm and the Labor and Employment Department, I want to welcome you here today and thank you for attending. We have a dynamite program for you today, and here are the areas we're going to be covering. Because there's so many aspects to return to work, this is the agenda for today. We're going to do an overview of the legal considerations that underpin the best practices we're giving today for a safe return to work. We're going to start with infectious disease preparedness and a response plan, safety from the OSHA perspective. Then we're going to go to pre-shift screening and temperature taking, and COVID-19 antibody and diagnostic testing, and then how you respond when there's a confirmed COVID-19 case in the workplace. With that, I'm going to turn things over to Jim Curtis, one of our OSHA experts, to get us started today. Jim?
Thank you, Carla. I appreciate everyone tuning in today. Let's talk about some of the legal considerations when we're thinking about safety as businesses are returning to the workplace. Largely, they're broken down into four broad categories. We always recommend our clients are looking at the state and local executive orders, the OSHA guidance, the CDC guidance, and the EEOC guidance on these issues. I would note that CDC and OSHA have both issued guidance documents for specific industries. It's beyond this webinar, but be sure to review OSHA and CDC guidance to make sure whether they've issued any specific guidance for your industry so that you're sure to follow that guidance. So let's walk through these categories here. State and local executive orders. As we all know, the state orders have been coming fast and furious over the last week. I believe that about 40 states will have some form of a plan in place by this weekend. And just last night, Illinois, my home state, I'm in the Chicago office here, Illinois announced a 5-stage plan to reopen the state. Many of these plans, as they're coming out, contain similarities to them, but there are critical differences with regard to the details, especially when it comes to safety. Most of the plans cover things like masks and social distancing, employee assessments, and travel restrictions, but they do that in subtly different ways and sometimes dramatically different ways. So it's very important that you know which executive orders affect your facilities, which jurisdiction you're in, and that you understand what the executive order is requiring, because sometimes those are even different than what OSHA and the CDC has recommended. Most states are looking at some sort of a phased approach for reopening. Keep your eye on the fact that many cities and county public health departments also have orders in place. Those orders may be more restrictive than the state orders and more restrictive than the CDC and OSHA guidance. So be aware of those. We've seen as these orders come out, sometimes they're internally inconsistent or somewhat confusing. Seek clarification as necessary. We've had lots of calls over the last month with various local jurisdictions and state public health folks trying to get clarification on these orders. And it's one thing's clear to us is that the doctors and scientists are learning this in real time as we're learning it as well. And so sometimes these orders change and they need to be tinkered with. We recommend to our clients that always use the CDC guidance as a touchstone when dealing with unclear orders, because the CDC, most of what is coming out of both OSHA and the states is originally flowing from the CDC. But the key again is to know which state orders and local orders affect you and be well versed in them. There are 3 regional alliances that have formed, at least as of May 4th. There's one out west, one in the Midwest, and one in the East. These are just trying to cooperate. These jurisdictions are trying to cooperate with one another on safety and strengthening their healthcare systems and developing systems for tracking and testing. However, they're not necessarily moving in lockstep, and they do have different requirements and timelines, but they are trying to coordinate on some of these issues. So that's actually good news, at least from my point of view. So let's talk about the CDC here for a minute. As we're getting back to business, from the CDC perspective, they've issued some guidance for cleaning and disinfecting businesses as you're getting back up and operating. So businesses should evaluate what needs to be cleaned, implement a plan, and update that plan as necessary. I've added a couple slides here from the CDC website itself for guidance on cleaning and disinfecting. It's fairly basic, but I wanted you to have this as a reference point. I'm not going to go through it word for word, but a couple of things I do want to point out. Under number 1, in developing your plan, if areas have been unoccupied for 7 or more days, from the CDC's perspective, if the virus was ever there, it's no longer active. And so from the CDC's perspective, you just need to maintain existing cleaning procedures in those areas. One of the other just sort of basic recommendations is to make sure that you have an adequate supply of cleaning products on hand, and check that volume before you get back up and running. There have been shortages around the country, and you're going to need to make sure that you have that in place and that it is the appropriate type of cleaning or disinfectant. Look for an EPA-approved disinfectant against COVID and make sure that that is the type of disinfectant that you're using. This next slide is the flow chart that the CDC has provided for how to go about disinfecting different areas of the facilities. Again, I won't walk through this, but I wanted you to have this in the deck as an easy reference point, because I think this flow chart is a fairly simple way of helping to evaluate your facility and work through these issues. So let's talk about OSHA considerations. As most of you may be aware, there's no specific OSHA standard for COVID-19. However, there's several standards, such as the PPE standard and the respiratory protection standard, that may apply. And there's also the general duty clause that applies to any recognized hazard. And certainly, COVID is a recognized hazard. So what OSHA has done is OSHA has issued a guidance document on preparing workplaces for COVID-19. OSHA recommends that employers conduct a risk assessment of its facility, and this is somewhat similar to any risk assessment that you might perform for any process or equipment that you have in your facility. It's just a COVID-19 risk assessment. To assist employers in doing this, OSHA has broken places of employment into four different types of risk. There's very high or high risk. Those would be hospitals and healthcare industry. Most of them have been busy as essential employers, and so they're not really going back to work in the first place. I wouldn't think many of you fall into that category. The next category is medium risk. Medium risk are workers that have frequent contact with travelers or direct contact with the public in community spread areas. Now, the OSHA guidance document was issued before we had such heavy spread throughout the United States, but certainly in urban areas where you have much greater risk, many more cases, you would probably be considered community spread areas. The last category is low risk, and low risk would be those facilities where workers do not have direct contact with the public. So once you have taken a look at your risk, OSHA recommends that you get an infectious disease and preparedness response plan into place. So let's talk about doing that. We recommend that employers put a written policy into place as you're developing this, and review it regularly. As we all know, this has been a very fast-moving issue with guidance and advice from the government agencies changing on a weekly, if not daily basis. So I would recommend that you get a written plan in place, that you review that plan and modify it as necessary. I really view these as living documents that need to be updated as things change. We should be considering the level of risk for the work site and the jobs that you have at your work site. Consider where, how, and to what sources employees may be exposed to COVID. We're talking about, general public, coworkers, customers, vendors, other folks you may have at site. The plan should also consider individual risk factors for employees at your site. For example, older employees, employees with chronic medical conditions, and pregnant employees. Once you've identified the sources and risk factors, you should implement protective measures. Good hygiene, we've been talking about this for 2 months now, but that has been the cornerstone of trying to defeat COVID-19, and it remains the cornerstone of any plan. So make sure that you've got the good hygiene procedures in there, frequent hand washing, use of sanitizer, telling sick employers or employees to stay home if they're sick. If employees sneeze or cough at work, they should be covering their mouths, providing visitors with tissues, customers with tissues and easy access to receptacles. Consider flexible work policies such as telecommuting. Most of us, to the extent we can, have been telecommuting for some time now. As you're getting back up and operating, consider if some of those employees can continue to telecommute or possibly stagger their shifts. Again, fewer employees at the workplace present fewer potential exposure opportunities. Discourage employees from sharing workspaces. As you're back in the office at the facility, don't be using common phones, common desks, common offices. No more, sharing of tools and equipment to the extent possible. And ensure that there's a supply of sanitizer and other hygiene products at the facility. The plan should establish robust housekeeping and cleaning schedules. This is an overlap with the OSHA and the CDC here, but again, OSHA is recommending frequent cleaning of common spaces, restrooms, break rooms, lobbies. In fact, the CDC has identified restrooms as particularly important as everyone is getting back up and working, both for cleaning and trying to deal with workflow issues. And then make sure that we're frequently cleaning commonly touched areas, so countertops, reception desks, copiers, printers, community computers. To the extent you have to allow people to continue to use these common pieces of equipment, let's make sure we're cleaning those regularly. You should, as part of your plan, be looking at the employee workflow through your facility. The big issue here is social distancing. This is an overlap in almost all of the executive orders out there. We're talking about the 6-foot rule that everyone has been seeing in the media and been talking about. Look at your facility and see how you can modify the physical layout and the workflow to maintain that 6-foot social distancing. Staggered shifts, staggered breaks, staggered lunches, so that you don't have employees all getting up and going in the same direction at the same time. Think about employee workflow when entering and exiting your facility. Perhaps establish permanent entrances and permanent exits if you can, so you don't have people coming and going in opposite directions at the same time. Think about the time clock, where employees check in, those sort of areas where people congregate in the morning and in the evening. Look at locker rooms, break rooms, and common areas. And anywhere employees may be gathering, think about those spaces and how you can limit it to the greatest extent possible. OSHA recommends that as part of the plan, you identify and develop a process for addressing new sick COVID cases. I believe Condon's going to talk about this in more detail, but from the OSHA perspective, again, OSHA wants to make sure that we are limiting, we're doing everything we can to limit COVID exposure. So isolation, restricting contact with anyone who may be sick, doing that tracing, and beyond all that, cleaning and disinfecting. OSHA also recommends considering potential engineering and administrative controls, such as increased ventilation, high efficiency filters. Where you can't maintain that social distancing, think about installation of barriers. We've all seen it at the grocery store and at other workplaces where the cashier has a plexiglass barrier that they've erected between the customer and the cashier. Those sorts of things can be implemented in any workplace. So if you have employees who are going to have to be closer to each other than 6 feet, think about those sorts of engineering controls that might limit the exposure between them. To the extent possible, limit third parties on site. Replace face-to-face meetings with virtual meetings. Restrict employee travel. If you don't have to have employees going out to client work sites, don't do that. And consider other protective equipment where it's appropriate, such as gloves, face shields, goggles, respirators. One of the other critical aspects in all of this is employee training. Prior to restart, let's make sure we're training our employees out there. We have to remember that we're having to change a lifetime of social habits here. People have dealt with the workplace a certain way for decades, and we're now asking them to rethink that and change all of those social habits. So it's critical that employees understand the new procedures and that it gets reiterated to them over time. So let's make sure we're updating and refreshing that training regularly. This is not a one and done. We're going to have to be reminding employees, probably early and often, to maintain that social distancing. To the extent they have to be wearing masks, wear masks. Those sorts of issues in the workplace, because this is not stuff that employees are used to doing, and it's not going to come to them naturally, at least not at the outset. Third parties on site, I just want to spend a minute here. I know I touched on this earlier, but part of your plan should be thinking about who are all the different types of third parties that come onto site, and let's think about whether they need to be there in the first place. You may want to put a policy in place, if it works for you, to really limit and restrict those third parties from being on site at all. One of the ones I want to highlight here are temps and contract workers. Don't let this category fall between the cracks, because those folks are going to be at your work site. And let's make sure that all temps and contract labor are properly trained and following the COVID policy just in the same manner that your full-time employees would be doing that. Develop a contingency plan for future outbreaks, and we're talking about the second wave here. Let's make sure that your plan thinks about things like increased absenteeism, options for conducting essential operations with a reduced workforce if you have to do that, cross-training employees, what's going to happen if we have an interruption of your supply chain or delayed deliveries from certain vendors, and how are we going to deal with these things, so that we can hope that we can, as the second wave comes, as all of the professionals have been promising us it is coming, we can deal with those issues and with as limited disruption as possible. And lastly, I want to put on everyone's radar screen, if your facility has been idled during shelter in place here, let's think about safety for the non-COVID issues as well. This isn't just a COVID-specific safety issue. So let's make sure that all of your equipment is current on its preventive maintenance, and it's safe to restart that equipment. Your equipment should be visually inspected to ensure guards and interlocks on gates and things like that are in place and they're functional. Let's make sure your employees are up to date on their training or recertifications if necessary. Some of the OSHA standards out there require annual or like the Power Industrial Vehicle standard every 3 years. While your facility has been idled, some of those certifications may have lapsed. So let's think about that. Let's conduct refresher training as necessary to ensure that employees understand the safety protocols, and as everyone's getting back to work, they're going to do it safely. So with that, I'm going to turn to Carla with the pre-shift screening and temperature taking.
All right, thanks, Jim. I'm also going to read the CLE code now, and that code is SS, as in Seyfarth Shaw, the 2 letters, SS1337. That's SS1337. So as I mentioned earlier, I'm going to discuss pre-shift screening and temperature taking, and Con is going to cover COVID-19 testing. But before we get to the detail of the best practices on those, Condon and I are both going to start by discussing why as employers we want to be doing screening and testing to the extent we can. It's an important part of an employer's return to work.
Hello?
Carla, I think we lost your audio.
Well, I'll pick up, this is Condon McLaughlin, I'll pick up this slide and then hopefully Carla will rejoin us momentarily. Why is return to work screening so important? Some of these points are self-evident, others may not be. Obviously, everyone wants to provide a safe and healthy workplace generally, for all the reasons that Jim articulated, not only legal, but business related, doing the right thing by your employees, that's quite simply in everybody's interest, and it's necessary for the economy to get back on its feet. Importantly, reliable screening, and as we'll discuss, testing, is important to reassuring employees that you are doing what is necessary, what is medically recommended, and what is legally required so that employees are comfortable going back to work. A poll was issued earlier this week, and of course polls can tell you just about whatever the poll taker asks, but this poll said that 65% of Americans are not comfortable returning to work presently. That's a disturbing number, but it's also insightful because you're going to need to reassure people that they're coming back to a workplace that is safe, that is healthy, and that they can return to with comfort. You'll also need to reassure third parties, customers, vendors, and others who are going to need to be on premises that you are doing what is needed to make a space safe for them, even though it's not their workspace. Then there are legal concerns. Tort liability. How does that come in? Aren't these issues covered by workers' compensation? Well, maybe as to employees, but not as to others. For example, if a third party is infected from your premises, or perhaps the family member of a worker who is infected in turn becomes infected, you may be exposed to tort liability. There are also exceptions to workers' compensation preemption if the employer acts willfully or wantonly or even grossly negligently. So it's very important. There's some talk in Washington this week. Senate Majority Leader McConnell is proposing some sort of employer immunity bill, which has met opposition from the Democrats, but who knows, maybe a deal in that regard is possible. Other legal risks are also reasons why you must present and ensure a safe workplace for employees to come back to. OSHA concerns, Jim has already mentioned. ADA, where does that come in? Well, certain individuals, for example, those with immunodeficiency disorders, are more likely to be prone to COVID-19. Similarly, the same is true of older workers, which is where ADA comes into play. If you require somebody to come back to work, and they must come back to work or risk losing their employment, there may well be ADA and age discrimination cases. And of course, there are state and local counterparts to those federal laws. Hugely important, hard to qualify, but as should be obvious to many of you, is reputational risk of having multiple positive cases or worse yet, deaths at your workplace. And lastly, it's important to do what you can to fight COVID in the workplace in order to help reduce the incidence of it nationwide, to flatten the curve, to avoid the recurrence of an uptick in COVID. Let's tune in now and see if Carla is back to pick up our next slide. Carla, are you there?
I am here. Can you hear me?
Yes.
Okay, great. I guess we just got over the one thing that could go wrong with our webinar. So, all right, so let's go on to employee screening. So you want to be clear when you do this type of screening, you'll do some kind of communication announcing we're going to be doing pre-shift screening. That as the employer, you're doing this simply to determine if someone is fit for duty. You're not certifying anyone as healthy. You're not the employee's healthcare provider. And when we do this kind of checking, we're just confirming that at that moment in time, you are fit to enter the workplace or appear to be asymptomatic. And just because we let you into the workplace today at this moment in time doesn't mean we're giving you a clean bill of health or anything like that. The employee could contract the virus later that day if they go out to lunch or after they leave work. So let's talk about the types of screening. Screening can take several different forms, and you can decide what works best for your workforce. You can designate an employee to ask general screening questions to employees prior to the start of work. You could have a written questionnaire that employees fill out. You could have an electronic questionnaire, like through an app or something, or on your intranet that employees fill out. And we've also had clients in large non-exempt work environments simply post something at the time clock that says, when you punch this time clock, you are certifying that your answer to all of these questions is no. So before we get to what the questions are, for option one, if you're having an employee administer the screening, so you're having someone either pass out written questionnaires or give oral questions to people, the employee designated to do that should have access to all of the appropriate personal protective equipment. They should have access to, sanitizer, and they should be directed to keep social distance. They should have gloves and a mask while they're doing all this. You want to protect that individual. You should also give consideration to where you're going to do this screening. You want to do it in a place that maximizes privacy for the people being screened. If someone is refused entry, if it can be avoided, you don't want to march them out in front of their colleagues. You want to conduct screening in an area where if an employee is refused entry, they can leave the building, without walking past other individuals. So I put up on the slide questions that you can ask about symptoms and exposure to COVID-19. The CDC updates regularly its list of symptoms. This reflects the current information, but as Jim mentioned, you should be referring back to the CDC website because it is updated continually based on the best information that they have. Now, in the early days of the crisis, questions about recent travel were a main area of focus. We asked, for example, has anyone traveled to China? Has anyone traveled to Italy? Now the virus has gone global, so those questions may have some less utility, but the CDC still has countries that are designated as level 3. So if you want to ask about those level 3 countries are Iran, China, any country in Europe, the UK, and Ireland. And the CDC, of course, recommends no non-essential international travel, and that anyone who travels internationally should quarantine themselves for 14 days. And the same is true for any kind of cruise ship travel. There is a level 3 notice in place for that. So you can add questions about that kind of travel on the form as well. When we use the term close contact, you see over on the right side of the slide, we're talking about a person that you're in close contact with means household member, intimate partner, caregiver, or someone that you're having face-to-face conversation with and you're less than 6 feet close to them for a prolonged period of time. And we often say 10 minutes or more. So the idea is if an employee answers yes to any of the screening questions, they're directed to leave the premises and follow up with their healthcare provider. And out of an abundance of caution, you should sanitize the chair, table surfaces, whatever you have set up for where the people are during the screening if you have someone who is turned away. So in terms of documentation regarding the results of the screening, different clients take different approaches. Certainly if there's a local requirement or an agency directive to keep the answers, then you need to do that. But otherwise, the answer depends a little bit on your record keeping. So keep in mind that although these types of questions are permitted by the EEOC is also clear that medical information collected in the screening process is subject to the ADA confidentiality rules. And federal regulations say that confidential information under the ADA has to be kept on a separate form in a separate medical file and be treated as a confidential medical record. There are some exceptions in the regulations, but they are pretty narrow. Essentially, whoever collects it, HR, legal, can give it to supervisors and managers to be told about restrictions on work duties. For example, this employee is not coming to work today. First aid and safety personnel in the event of emergency treatment. Government officials who are investigating compliance with the ADA, workers' comp agencies and officials, and they can be shared for purposes of insurance. So with regard to record keeping, if you're going to keep the answers to the screening, you need to be confident that you can fulfill these ADA requirements about the confidentiality and the separate record keeping. Now, some employers don't retain the answers to screening, like let's say we're going to be talking in the next section about temperature checks, because they view that they have a protocol, they are directing people to follow the protocol for the screening, and that if someone is allowed to work that day, that is confirmation that that person answered in the negative to all of the questions and were okay to work that day. Other people retain just the answers that are affirmative, that refusing someone to enter the workplace. But just remember, if you're going to keep the responses, make sure you keep all of them, and your record keeping is very good, because if you're going to take the position that you're keeping all of the responses, you know, and someone doesn't turn in a few days or a week or whatever, an enterprising plaintiff's lawyer will argue if you don't have the records, you didn't do the screening on that day. So in terms of temperature screening, the EEOC has said this is acceptable, especially given the severity of the pandemic. It was a while into it before they said that it was okay for employers to do this. Generally speaking, temperature checks are optional, not mandatory, but there are some state and local jurisdictions where it is mandatory. So again, if you are in that type of a jurisdiction, you need to do the temperature checking, and we would recommend that you keep the results to prove compliance in those jurisdictions. The most frequently used protocol in asking employees about whether they're feverish is to allow the employees to self-certify that they have taken their temperature that day and don't have a fever. A lot of people don't have access to thermometers, much less thermal thermometers, which are the gold standard for this type of screening. So they rely on self-certification of the employee. If you're going to actually conduct temperature screening, we recommend that the employees take their own temperature, and that this is not done by the screener or another employee. Depending on the type of thermometer, it could be quite intrusive, and it also puts the screener at risk. So the employee, if she's testing herself, should be provided gloves, the thermometer, and antiseptic wipes. They should be directed to wipe it down before they take their temperature and after they take their temperature. If they have a temperature of greater than 100.4, They should be asked to leave the premises and follow up with their healthcare provider. In terms of documentation, I've already spoken to that. It's the same principles with the symptom checking, the same with the privacy considerations in terms of where you conduct the temperature screening. And now I'm going to turn it over to Condon to talk about COVID-19 testing.
Thanks, Carla. As many of you know, testing has been an extremely hot and important topic in the last month. It's very difficult to keep up with the medical developments and the legal developments, but we will try to bring you the latest information, including from yesterday's FDA website. It's important to know that we finally got guidance from EEOC in this space permitting mandatory testing of employees as a condition of return to work. The Commission had previously at least indicated by its silence that it had not approved that testing, that it approved symptomatic tests, questionnaires, like temperature taking. But on April 23, it expressly endorsed mandatory testing for COVID-19. It did that, of course, with some appropriate caveats that the employer must ensure that tests are accurate and reliable, and that it should regularly review guidance from FDA and the CDC in order to know what tests are recommended, what tests are not recommended. Beware unapproved tests. There's been a rash of those reported just this week, specifically antibody tests that have been used, purchased, sold. They're not authorized by FDA for emergency use, unlike other tests that we'll talk about specifically. So you want to make sure that whatever type of test you use has FDA authorization for emergency use. That is not a permanent authorization, but it's an indication that the agency thinks, based on the information it knows today, that those tests are safe and reliable. EEOC, even before issuing its April 23 guidance, had said that return to work testing for those who have tested positive for COVID-19 is permissible, and of course that remains the case. In general, testing can be required as a condition of returning to work. In other words, if you can show that the employee being at work is necessary for the employee to perform their job, then their undergoing a test as a condition of return to work is legal. The upshot being that in general, someone can be discharged or otherwise disciplined for refusing to undergo a return to work test. There may be exceptions. People may request exceptions for disability-related reasons. They may be resistant to tests, or they may be have allergic reactions, particularly to blood draws, which I'll come to. There may be religious-based exceptions, specifically to blood draws. Jehovah's Witnesses and some Christian Scientists are opposed to those on religious grounds, and those will need to be considered case by case, but that goes beyond the scope of today's program. Types of tests. This can get perhaps a little mind-numbing. I'll try to avoid that, but you need to know what is out there, what is approved, what is not approved, what may be approved, and what's coming down the pike. The most common sort of test is a universe of diagnostic tests called molecular or NAAT tests. For those scientifically inclined, that stands for nucleic acid amplification tests. These test for the DNA of the virus in your body. These are to see whether someone has COVID-19. They are detection tests. They are diagnostic tests. There are now approximately 3 dozen of these tests that have been approved by the FDA for emergency use authorization or with emergency use authorization. But you need to make sure that the test you're using is FDA approved. All of these tests require that results be analyzed at a FDA approved laboratory. Those are increasing in number all the time, and it is possible to have a test administered by a healthcare professional, either at a designated collection site, which is a recommended best practice, perhaps at your workplace, although that's currently unclear, at least to me. But in any event, the result is going to be sent to an FDA laboratory, FDA-approved laboratory for analysis. Antibody tests. These are, there's been a lot of buzz about antibody tests, which are also called serological tests. These test for the presence of antibodies that the body has developed in resistance to COVID-19. In other words, you have to be exposed to COVID-19 in order for an antibody test to be successful. For that to happen, it means that you've got to potentially have COVID-19. You may be asymptomatic, but you have to be exposed to the virus. And that means that it's going to be successful for a very limited universe of the population. Given the relatively low infection rates in most areas of the country, most people returning to work are not going to test positive for the antibody to COVID-19. Nonetheless, these tests have received a lot of attention in the media and in the medical community, not least of all by Dr. Fauci, who has in effect become the national spokesperson really for the fight against COVID-19. And 11 tests, 11 antibody tests are now approved by the FDA. That was not true a month ago. Going into April, there were no approved antibody tests. The CDC, together with the National Institutes for Health and other federal health organizations, have been pushing hard to develop these tests and to get them to market. Why is that? Why is it? Because it's somewhat ironic that there is so much buzz about a test that requires you to have COVID-19 in order to test positive and therefore be cleared to return to work because you've developed resistance to it. It seems a little counterintuitive. Well, there are various theories, some I think more credible than others. Some think that it's a sort of unstated way to implement a kind of herd immunity strategy like the UK proposed that would allow people to be exposed to COVID in order over time to build up immunity. But that, of course, entailed an incredible incidence of positive cases and indeed deaths in the interim, and has never been endorsed as public policy in this country. But one suspects that those who are so committed to antibody tests believe that the infection rate in the country is much higher than is reported, in part because so few people have been tested. So although the reported incidence may be somewhere around 5%, perhaps the actual incidence is closer to 20%, much higher than that in New York and other urban areas. And so these tests are relevant now, and they're going to be more and more relevant in the future as more people are exposed to the virus and therefore develop antibodies to it. The other reason why antibody testing is so key in the return to work space is because unlike a diagnostic test, an antibody test result will last, at least for some time. We don't know if it's permanent. We don't know whether the resistance is permanent. But a diagnostic test only tells you you're not testing positive that day, which leads me to the next area. The testing is not a panacea. Just because you test as a condition of return to work does not mean you are providing a safe and healthy workplace for people to come back to or people to remain in. For one thing, a negative result today, as far as a diagnostic test, you're not COVID-19 positive today, says nothing about whether you will or won't become infected down the road, be it in a week. Maybe you already have the virus, but it's not detectable. And so a one-shot return to work test does not insulate the employee or the employer from future COVID-19 developments. So far, at least, EEOC has not approved repeated testing. You cannot test workers every other week as a condition of continued employment. That is not in the EEOC guidance. That is not part of returning to work, and that would be a major move by the agency against the ADA's general prohibition against medical exams of current employees. There are shortcomings with antibody tests too. Again, those provide a more meaningful long-term result, but they have downsides as well. But by the way, I should say that the FDA has declared diagnostic tests to be highly reliable. It has not said the same thing as of yesterday about antibody tests, in spite of all the support for those tests by CDC, Dr. Fauci specifically, and others. For several reasons. For one thing, a negative result is not in other words, you don't have the antibodies, doesn't mean that you don't have COVID-19. You can't use it as a diagnostic test because the antibodies take time to develop. And so somebody could be COVID-19, they wouldn't test as having the antibodies, but it would say nothing about their COVID-19 status. So the FDA expressly says what is here on the screen: don't use an antibody test as a diagnostic test. It doesn't tell you whether somebody does or doesn't have a COVID. These tests are best suited for those most likely exposed to the coronavirus. And so that means healthcare workers, first responders, people in New York City and other high-density urban populations where the infection rates are higher, and therefore antibodies are more likely to have developed. Antibody tests are inevitably more effective where infection rates are high, which is ironic because in a sense it means that there need to be more infections for those tests to really be helpful as far as whether people are safe to return to work or not. They are not likely to be effective in rural areas, low-density areas where infection rates are generally low. There are multiple practical challenges with testing. These are getting better. The rumors and reality of not being able to get a test, not being able to get a diagnostic machine, not being able to get to a clinical site for testing, things are getting better. I won't say that they are uniformly available to all employers. There may be a wait. There's a cost. Antibody tests cost about $100 a pop. They have to be, the results, as I mentioned, have to be analyzed by FDA certified labs. So you'll have to connect with one of those. Tests of whatever type, even the swab test, should be administered by a healthcare professional. And as I alluded to, there are cost and access issues. So as Carla's going to talk about in a minute, testing entails additional obligations, much like she discussed with regard to temperature taking. There are medical protocols, privacy protocols that need to be ensured. If you have a positive test result, you're going to have to report that to local health officials. EEOC has said you're not to talk to coworkers about somebody's testing positive. And yet, if they have been working in immediate proximity with the individual and maybe the social distancing wasn't working as well in practice as it was supposed to, whether you have a duty to talk to those employees and inform them that they may be at risk is going to be something you'll want to get some more legal advice on. Of course, you need to be careful who you communicate the positive result to. Communicate it to people that you're legally obliged to, namely local health officials. If they require that you communicate to others, then do that, but they likely won't. If you communicate to local health officials, that will probably satisfy your reporting duty. Lastly, the point here is that testing is part of a solution. It's the beginning of a return to work solution because it allows people to get back to work knowing that they don't have COVID-19, that their coworkers don't have COVID-19, or that they've developed antibodies and therefore are not likely to develop it or pass it on to others. But that's just a start. After that, all of the symptom assessments that Carla talked about, questionnaires about employees' health status, perhaps other sorts of monitoring, and of course, as Jim emphasized, personal protective equipment and social distancing are absolutely essential. Testing is just the beginning of getting people back to work safely. Now I'll turn it back to Carla.
All right, thank you. So I'm going to talk about responding to positive cases in the workplace, so employees who report that they have tested positive for COVID-19. So here's what we recommend is consistent with the CDC guidelines. First, you want to confirm the diagnosis. You can confirm it verbally with the employee or someone else who has firsthand knowledge of the employee's condition, perhaps a family member. You want to confirm the date and time of symptom onset as best you can, because that is going to be key to your contact tracing. Then you want to try, again, as best you can, to determine the activity of the employee for 48 hours prior to symptom onset. You can talk to the employee about where they work. If you're in an environment where people are badging in and out of doors, you can also run a report that way. But you're going to determine the activity so that you can identify the employees that the person who has tested positive has been in close contact with, again, within 6 feet for a prolonged period of time, we say 10 minutes or more, in the 48 hours prior to symptom onset. Then you want to talk and determine about the locations in which the individual was working in the 48 hours prior to symptom onset, or if they remained in the workplace while they were symptomatic for a period of time, all the way up through when they left the workplace. So once you determine those locations, you're going to isolate those areas. CDC recommends 24 hours if possible, and then you open the doors and windows to increase the air circulation, clean and disinfect. If you can't isolate the area for 24 hours, consider using a local deep cleaning service. So then once you've determined the people, the individuals in close contact with, you want to tell them to go home and quarantine for 14 days. Certainly if they can work from home, that's an easy call. You just tell them to work from home. There is an exception to this. The CDC has a separate guidance on critical infrastructure workers. And critical infrastructure workers, it's a mouthful, who are asymptomatic can remain in the workplace. Now, the footnote to this is if they can work from home, that's the best thing to do. But if they need to be on site and they're a critical infrastructure worker and they're asymptomatic but have been exposed, they can stay on as long as they remain asymptomatic and do the following. They need to participate in pre-screening, temperature taking, assessing symptoms, like I talked about in the first section. So if you're already doing that for everybody, you're set. They should wear a face mask at all times for 14 days since the last exposure. maintain social distance, and then you want to continue your disinfecting and cleaning. You should also, in the wake of a confirmed case, distribute a employee communication, just generally saying someone has, who is in our workspace has tested positive, and just a reminder on social distancing, good hygiene, covering your coughs, etc. You should contact your local Department of Health regarding the confirmed case and follow their guidance. As Condon alluded to, the EEOC takes the position, as does the CDC, that you should not be revealing the identity of the person who tested positive. The idea being, you're the employer, you know who the individual is, you don't need to go run around telling other people who that individual is, because you have ways of determining where they were and who they were in contact with. Now, this is a point of frustration for a lot of employers, because it would be easier to contact trace if you can reveal the name. And this is why a number of employers are looking at contact tracing apps to take some of that mystery out of, relying on an employee's memory as to who they talked to and who they were in close contact with. We don't have time today to go into all the details of the pitfalls and benefits of contact tracing apps, but the highlights are, if it involves any kind of tracking of geolocation, there are a number of states that prohibit geolocation tracking of an individual without their consent. If it's a mobile app, you need to confirm what kind of data is being taken from the phone. If it is an app, for example, or a wearable, when is it going to be enabled and disabled? Who's going to enable it and disable it so you're not tracking them outside of work? Will it be mandatory or voluntary? So now I want to talk about an exception to revealing the identity of an employee who has tested positive. Condon already mentioned you can reveal that to a public health agency, but earlier this month the EEOC also published another exception that says a staffing agency or a contractor who places an employee at another employer's workplace may reveal the name of the employee to that employer so they can contact trace, basically putting that employer in the same position as you are when you have an employee who you know has tested positive. You can contact trace from there, but not further disclose the name. And when can they come back? There are two different options. And let me say at the beginning, both the CDC and the EEOC says you should not require sick employees to provide a negative COVID-19 test result in order to return to work, so as to make things less burdensome on healthcare providers. A footnote to that would be you can consider getting one of those notes, because you as the employer are the one who has to show that you are keeping the workplace safe, and if you are the subject of litigation, wrongful death, negligence, you're going to want to be able to say that you got that fitness for duty if it's feasible in your local area. So there's two options in terms of returning to work for the employee after they have tested positive. There's the symptom-based option and the test-based. The symptom-based option is no fever for at least 72 hours, respiratory symptoms have improved, and 10 days have passed since the symptoms first appeared. If it's an asymptomatic positive employee, it's 10 days since their positive test. Option 2 is the test-based, and it depends on how available testing is. They've got to have no fever, respiratory symptoms have improved, and 2 negative tests in a row that are more than 24 hours apart. If they're asymptomatic, again, the test base is just going to be those 2 negative test results more than 24 hours apart. That concludes the formal part of the presentation. I don't know, it looks like maybe we don't have time for questions, but that concludes the presentation. Thank you. Okay, so it looks like we don't have time to take questions, but we will have your questions. We will get them to the presenters and the relationship attorneys if you have one here at Seyfarth, and we will do our best to get you answers to those. Thank you again so much for joining us today. We hope you found it helpful.
Thank you, everyone.